الرحيم. أستاذ مساعد الدكتور احمد صلاح حميد من كلية طب الاسنان قسم جراحة الفم. محاضرة اليوم سوف تكون عن dental management of patient with bleeding disorders. As we know, in the normal person, the possibility of spontaneous bleeding is very rare, except in certain situations, such as in case of menstruation. Otherwise, any spontaneous bleeding, this may consider as abnormal condition. So actually, when there is disturbances or when there is spontaneous bleeding, that means there is some disturbances in the hemostatic mechanism, because there is hemostatic mechanism in the body, in the human body, and this is responsible for cessation of bleeding. In case of any disturbances or any defect or any deficiency in the hemostatic mechanism, this will lead to spontaneous bleeding or profuse bleeding. So this may occur due to congenital factors or could be due to acquired factors. In case of injury of the blood vessel, as we can see here, that the injured blood vessel, usually the hemostatic mechanism will attempt in order to stop this bleeding. So the hemostatic mechanism includes three phases: the vascular phase, the platelet phase, and the coagulation phase. As we can see here, this is the ruptured blood vessel. When there is injury or rupture in the blood vessel, there is secretion of certain mediators. So there is in the vascular phase, there is what we call the spasm of the blood vessel, and this is constriction or spasm of the blood vessel. This is in order to constrict the blood vessel and to reduce the amount of blood released from the injured wound or from the injured blood vessel. After spasm or constriction of the vascular wall or the blood vessel, there is secretion of certain substances from the injured epithelium. Here we can see this is the injured epithelium, and there is secretion of certain substances. These substances will attract the platelets, which is the megakaryocytes or cells within the blood, and this will aggregate or attach to the injured vessel in order to seal the injured wall of the blood vessel. Then after, the platelets themselves will secrete also mediators, and this is in order to attract another platelets in order to form what we call the platelet flood. Then after, there is what we call the coagulation factors. In case of the coagulation factors, there is activation sequences or cascade of activation of the coagulation factors, which are proteins found in the blood. So through this activation, the end result of the activation of sequential activation of the coagulation factors, there is what we call the formation of the fibrin. So the fibrin here, as we can see, after the aggregation of the platelets, the fibrin formed in order to stabilize the blood clot. So the blood clot formed after spasm or constriction of the blood vessel in order to reduce the amount of blood loss, then the aggregation and attachment of the platelets to the injured wall, then the activation of the coagulation factor sequentially in order to form fibrin, which is stabilize the blood clot. So this is the normal hemostatic mechanism in normal person. In certain situation, there is actually what we call defects in one of these factors or in one of these phases, either in the vascular phase or in the platelet phase, or in case of deficiency of one of the coagulation factors, which are, as I mentioned before, these are proteins found in the blood. So in case of the vascular phase, some changes in the vascular wall, this will lead to profuse bleeding or spontaneous bleeding, or sometimes due to deficiency in the number of the platelets, what we call thrombocytopenia, and this will lead also to bleeding. Coagulation factors, any defect, whether congenital or even acquired during life, as in case of liver disease, this will lead also to bleeding or spontaneous bleeding. So in order to classify the bleeding disorder, we can classify them into non-thrombocytopenic purpures. That means the reason is not associated with the megakaryocyte, whether the function or the number of the platelets. So this includes vascular wall changes, as I mentioned before, due to autoimmune disease or due to deficiency of vitamin C and so on. Or disorders of a platelet function. So this is not thrombocytopenic, that means there is no defect in the number of the platelets, but there is defect in the function of the platelets or in the vascular wall of the blood vessel. Or thrombocytopenic purpose, which is due to decrease in the number of the platelets, and this could be primary, that means idiopathic, of unknown cause. So there is decrease in the number of the platelets. Or could be secondary due to exposure to chemicals, radiations, leukemia. All of these actually will lead to decrease in the number of the platelets, and this will lead to what we call, as I mentioned before, thrombocytopenia. Another classification is due to disorders of coagulations. That means the coagulation factors, there is deficiency of one of the coagulation factors, and this will lead actually to also bleeding. So this can be classified into, or further classified into, inherited, such as hemophilia and the Christmas disease, and also there is acquired, as in case of liver disease or vitamin deficiency, or even in certain situations the patient taking anticoagulants drugs. These drugs actually increase the blood flow and prevent the thrombus formation, and such as warfarin, or even sometimes the coumarin, and even antiplatelets actually, such as aspirin. So these drugs actually increase the blood flow. Patient taking these drugs for certain conditions such as myocardial infarction, angina pectoris, deep venous thrombosis. In this case, the patient may experience bleeding after tooth extraction, or even after giving inferior auricular nerve block. So what are the signs and symptoms of the patient with bleeding disorder? Patient may appear with ecchymosis or petechia. We will see what is the difference between ecchymosis and petechia. Hemerethrosis, which is bleeding within the joints, such as leg joints, such as the knee joints or ankle. Epistaxis, bleeding from the nose. Gingival ulceration and hypertrophy. Here we can see the differences between ecchymosis, as we can see periorbital ecchymosis, which is more than 1 to 2 centimeter in diameter. Also the peripheral, which is more than 3 millimeter, more oval actually. This is the petechia, and also, this is the peripheral, and the petechia, which is between 1 to 2 millimeter. So these are the manifestations of the patient with bleeding disorder. Also here what we call periorbital ecchymosis. This is actually also could be seen in case of trauma, head injury, or any trauma to the facial skeleton also could, but actually this is due to bleeding disorder, as we can see the ecchymosis, periorbital ecchymosis, or sometimes it's called raccoon signs. Here we can see this is hemerethrosis, bleeding in the joints and the knee joints also, and here also we can see there is ulceration and spontaneous bleeding in the gingiva, and this is also one of the oral complications of bleeding disorders such as hemophilia. So what is the medical treatment for such a patient, which is not the responsibility of the dentist, but it is the responsibility of the physician? So it is the responsibility of hematologist. We have to refer the patient for hematologist treatment according to the type, whether there is thrombocytopenia, that means decrease in the number of the platelets, or could be in the vascular wall, or could be due to one of the coagulation factor deficiency, as in case of hemophilia or Christmas disease. And also according to the severity, whether there is severe or mild or moderate of the condition. The treatment may include factor VIII replacement or stimulant, for example, desmopressin, or blood clot maintenance such as tranexamic acid or aminocauric acid. Here also the hematologist will send the patient to also for certain laboratory tests such as prothrombin time. Actually, prothrombin time is very important to measure the extrinsic pathway and also the amount, which is between 11 to 15 seconds. There is also activated partial thromboplastin time, which measures the intrinsic pathway, and also the common pathway. Bleeding time, measuring the function of the platelets, and platelets count, which should be 140,000 to 400,000, and this is measuring the number of the platelets. So, consider dental management. The dental management of patients with hemophilia. By the way, hemophilia is deficiency of factor VIII. And there is actually, it can be classified into hemophilia A and B, or sometimes type B called Christmas disease, deficiency of factor IX, or sometimes it can be classified into mild, moderate, or severe according to the level of factor VIII. The normal level of factor VIII is 45%. Sometimes if it is 5% or more, this can be classified as mild hemophilia. Between 5% to 1%, it can be classified as moderate. Less than 1%, it can be classified as severe hemophilia. So first of all, detection and referral. Detection through the sign and symptom, through the history, through the laboratory investigation. So we have to ask the patient about any history of spontaneous bleeding or any bleeding after tooth extraction, even the relatives, whether they have any spontaneous bleeding and so on. And here we have to refer the patient for hematologist. Consultation with the hematologist in order to discuss the treatment plan, whether the patient needs, for example, tooth extraction and which anesthesia or which type of local anesthesia, inferior nerve block or infiltration, because everything it needs certain level of platelets number and even the level of factor VIII. Simplet construction. Actually, this simplet construction is made of acrylic resin, and this is used in certain situations in order to stabilize mechanical stabilization of the blood clot. So this is simplet in order to stabilize the blood clot mechanically and to prevent dislodgement of the blood clot. Perform atraumatic and good surgical technique. Actually, atraumatic in order to prevent soft tissue injury and even trauma to bone with good surgical technique. Patient should be free of infection. Actual infection usually is a predisposing factor of bleeding. So here, infection, if present, we have to treat it medically, and then we can do, for example, tooth extraction, because as I mentioned before, infection exaggerated the condition. Use local measure to control excessive bleeding, such as pressure pad, collagen fiber, thrombin, oxysil or surgisil, and sometimes even if there is bleeding from bone, we can use bone wax as well. Consider a prophylactic antibiotic to prevent post-operative infection. As I mentioned, infection is a predisposing factor of bleeding. And also we have to avoid aspirin and aspirin-containing compounds, because aspirin, we know, it is antiplatelet, so to prevent the aggregation and formation of the blood clot, this is we have to avoid it. So this is actually the end of the lecture, and thank you for your attention.